Hi, I'm Dr. Leslie Sim, a clinical psychologist with Mayo Clinic. From time to time, people can overeat, especially during celebrations and the holidays. But when episodes of overeating are associated with a loss of control and are followed by behaviors to get rid of the calories consumed, it may be due to an eating disorder called bulimia nervosa. Bulimia nervosa is a serious, potentially life-threatening eating disorder. People with bulimia struggle with significant and overwhelming concerns about their body shape and weight. They may secretly binge, eat a large amount of food with a loss of control over their eating, and then purge, trying to get rid of the calories in an unhealthy way. Bulimia is characterized by recurrent binge eating and purging at least once per week for at least 3 months. Binges can include eating extremely fast, eating to the point of nausea, and eating when not hungry. They also occur in secret and are followed by strong feelings of guilt or shame. Binges also have accompanying experiences of loss of control. People will describe this feeling as if they can't stop eating, even when they want to. When diagnosing a binge episode, there is strong evidence that the feeling of losing control is more important than the amount of food consumed. Purging includes anything that individuals do to get rid of the food and calories consumed during the binge. This can include self-induced vomiting, abuse of laxatives or diuretics. People with bulimia may also use other ways to offset the calories consumed during binge eating, like fasting, excessive exercise, or abusing medications such as stimulants, diet pills, or other prescription medications that have appetite suppressant side effects. These behaviors occur immediately following a binge or at any other time. In bulimia, dieting drives a dangerous cycle. Individuals with the condition restrict their diet, leading to increased psychological and physiological pressures to eat. Ultimately, this leads to a binge episode, which is followed by purging, which is followed by further shame and distress. This leads to increased pressure to restrict, which restarts the cycle. The exact cause of bulimia is unknown. Many factors play a role in the development of eating disorders, including genetics, biology, psychological factors, and social expectations. According to the national surveys, the median age of onset is 18 years old. There are some risk factors that increase a person's chance of developing bulimia nervosa. These include dieting or losing weight for any reason, diabetes, medical conditions, or medications that interfere with appetite, a history of yo-yo dieting, being bullied or shamed for one's weight, and traumatic experiences. In contrast to what is commonly thought, bulimia can affect people of all body types. Sometimes individuals with bulimia are weight suppressed, meaning they weigh less than they should based on their personal history. The most serious consequences of bulimia nervosa include electrolyte imbalances that can lead to heart attacks or seizures. Individuals with the condition are 5 times more likely to have a heart attack. Inducing vomiting also causes significant damage to dental enamel and can cause sores in the mouth and on the tongue. Bulimia is associated with high rates of depression, anxiety, feelings of hopelessness, increased suicidality, or self-harm. The good news is that bulimia is very treatable. Individual therapy like cognitive behavior therapy enhanced and integrative cognitive affective therapy can help break the cycle. For adolescents with the condition, treatment includes family-based interventions where parents or guardians help normalize their child's eating and eliminate bulimic behaviors. Some individuals may need to go to a treatment center to break the cycle of binge eating and purging. If you have a loved one you're worried about, urge him or her to talk to a doctor. They are not alone, and treatment does help. Learn more about bulimia nervosa by visiting mayoclinic.org. We wish you well.